Welcome to New Perspective on NetStream TV. I'm your host, Barry Lefkowitz. Most people are not aware New Jersey has the second largest senior population in the country, which provides challenges to providing proper health care and care for them. Additionally, New Jersey also has one of the highest numbers of individuals with various disabilities and autism. My guests today are two extraordinary women. To my right is Geeta Fofandi, founder and CEO of Faith Health Group, and to her right is Christine Rios, Director of Operations for Faith Health Group. Ladies, it's a pleasure having you both here today. Would you share with the audience, each of you, your backgrounds, given the fact that, first of all, March is Women's History Month, and so it's great having two extraordinary ladies, and coming up is International Women's Day on March 8th. So, Geeta, we'll start with you.
Thank you so much, Barry, to having us, and happy International Women's Day to all humans out there. About faith and about me, I came in this country with a lot of dream. I came to do research here in United States.
Mm-hmm. And where did you come from?
I come from India.
Okay. Just wanted to make that
my
clear.
background is in nutrition. Okay. Back in India, I was a dietitian. I came in here to do research on hepatitis B second trial.
Okay.
And then I got privilege to work with lot of the clinician. Also, I did study in Montclair State University further to educate myself regarding the need and regarding the right choice which I can make and do my career further. I donated my life to the community to start something meaningful.
Mm-hmm.
Yeah. So here I am.
Okay, great. And Christine, your background?
Thank you, Barry, for having us today. My background is, I was born and raised in New Jersey. Mm-hmm. And speaking of Women's History Month, I graduated from an all-women's college, Douglas College, which is part of Rutgers University in New Brunswick.
My mom was dean of students at one time at Douglas.
Interesting.
Yes.
Okay, well, it's my alma mater. I'm very proud to say that because they believe in the empowerment of women. And I have been in home care for 30 years, so I've spent the majority of my career in home care, leading operations across assistive care, private duty skilled nursing, and most recently hospice service lines. And actually 15 of those years I've dedicated to advocacy work for New Jersey home care recipients, primarily focused around access to services, access to care, workforce shortages, and of course, ensuring reimbursement and policy decisions that are made by our lawmakers are in support of the home care industry, both the recipients and also the workers.
I would characterize both of you as very passionate about what you do. Why do you both have such a passion for what you do? Because given your training and everything, there were other areas you could have gone into. So we'll come back to Geeta.
So I choose this career path. I was doing my rotation in Hackensack, clinical hours in Hackensack, and I see
which is in North Jersey.
Which is in North Jersey, okay. And I see it's a very huge need to support each individual with the dignity and the quality of life. And I also part of the Home Care Hospice Association as a board member, and I see a lot of changes we require as a new policy affecting a lot our individual, their daily life. And I think human advocacy, I do the advocacy for the humans as well as I do advocacy for the right. So I think I made a right choice to donate my life to support each individual who are suffering for very illness at home. And this is the right choice. I can support them. Yeah.
Okay, great. And Christine?
I would say my passion is a desire to help people. That stems from my childhood. My father was a social worker, and
really?
yes, he worked for government programs in New York City, and I was exposed on a regular basis to his work. He would bring me with him, and I saw the impact that he made on people's lives and how he helped them change their lives for the better. And I wanted to be just like him and do what he did and make people's lives a little bit better. And I happened to fall into home care 30 years ago, and the reward that I feel on a daily basis, the joy it brings me to indirectly help people in such a significant, sometimes it's a small way, sometimes it's a significant way, it fulfills my life. And that's why I have a passion, and I've been in the industry for 30 years because I just love it and I love helping people.
Yeah, it's interesting. It's hard to imagine the amount of years the two of you have been doing this, because you both continue to look young, which I think is a reflection that you love what you do.
Yes.
And I think that makes a difference. Now, you're from the Faith Health Group. You founded it, and you're a critical part of Geeta's team. But what is the Faith Health Group?
So the Faith Health Group is a home care company. We do I started home care company to support individual with development disability, as well as support from the hospice, from home care to palliative care. We provide all line of services to the really ill patient at home. Faith is not, I did not started Faith to earn money. I started Faith to serve the community, and serving the community in a right purpose. That was our mission, to help each individual with quality, with the dignity, with their choice, which we can make them independent. Because our all are under the development disability, we have also one rehabilitation center and pre-vocational training center for 21 and above kids. I cannot say kids, individual. And when I see them smile every day, that make my day. And I feel the God give me chance to support each individual. That is a faith mission, to make them independent. And saying that, Christine is also bring one great addition to our team, which is PD, and I would like her to talk about that one. Yeah.
Sure. So Faith Health Group started out providing home health aid services, and I have to say Geeta is a visionary. She dreams big, and she wants to help more and more people every day. So expanding her service line from home care, which is home health aides caring for the senior, the elderly population, to the developmentally disabled, hospice, end of life, And now there's a great need for private duty skilled nursing for medically fragile children and adults. And this has been a project that we've been working on for the past year, and we're just about to launch private duty nursing.
Can, to help the audience have a better understanding, what is hospice? And I know, you talked about rehabilitation so that, they can really get a sense of how broad what you're doing. And how does that compare to, a patient being in a hospital, et cetera? So let's first start with, what is real hospice care?
Hospice care is end-of-life care.
Okay.
No more curative treatments available for an individual's serious illness. And what hospice care does is provide comfort care, quality of life to individuals and families on the last leg of life's journey. That's basically what hospice care is. We provide holistic care, mind, body, spirit. We take care of the entire being of both the patient and the family. We provide social workers, chaplains, we have physicians on staff, nurse practitioners, nurses, volunteers, home health aides, so that we can provide that holistic care to treat the mind, the body, and the spirit.
Now, but also the family who is obviously going through the initial stages of grieving because seeing a loved one who they know is going to pass away.
Right.
And you're part of that system to help them go through that process. Can you help them the audience understand what that means?
Yes, end life is a very challenging for the family who does not understand, because they have they don't know where to start, the process, because they are taking care of their loved ones who are going to be end life, and they know they will going to be dying. So where we come in a picture, and then we can support them emotionally, holistically, and our entire, we have a clinician, we have a nurse practitioner, we have a doctors, we have an educator who make them emotional support. Because when you're going through the end life, emotional support is very important to understand this is the pain, they're going through the pain, and they has to go to the courthouse with the right choice. So I think hospice is a very sensitive topic, but somebody has to do it.
If I could add, what we also do is we provide bereavement support to the families. First, we help them understand what the dying process is, what it looks like, what to expect, so there's no surprises, because if you've never seen it or gone through it before, you don't know. And after the patient passes, we follow family members for 13 months, providing support, resources, and just being available to them. Sometimes people just need someone to talk to and know that somebody's there for them.
Unfortunately, we have to take a break. We have to do that thing for commercial, but
Yeah.
I understand because, as you know, we're going to South Carolina to deal with two
hospice.
deaths. Please stick with us. We'll be right back because Faith Health Group is going to share with us what makes them different than traditional healthcare and what are some of the issues facing healthcare in New Jersey. So don't go away. We'll be right back.
I love that we both got an awesome network and save money doing it.
I know, $25. I love that it's guaranteed for 3 years.
Hey, we're sitting on a sign here.
Switch and get Welcome Unlimited for $25 a line, guaranteed for 3 years. Verizon.
No signal. I don't have home internet.
Oh, that's a red flag.
Find the bars.
Your mom looks a lot like me.
Yeah, couple of hotties.
Thank you.
Ah, man. There's dead spots all over this place.
There really are. Oh, wow.
Nothing. Are you getting a good signal?
No, I'm not.
It's time for Real Home Internet. Get it on the next generation 10G network. Only
Welcome back to New Perspectives. We're having an animated conversation with two extraordinary, accomplished healthcare providers from the Faith Health Group, and we're talking about the importance of home care and so forth. But New Jersey is facing a lot of challenges, as well as states across the country.
Mm-hmm.
What do you see are the major issues facing home health care providers in particular in New Jersey right now?
There's three major issues that we're facing currently. The first one is the Medicare Certificate of Need moratorium on allowing additional providers to provide care to the Medicare population.
Let me stop you there
Yes.
for a second. 99% of the audience is not going to be familiar with what is the Certificate of Need.
So the Certificate of Need is the program where Medicare, the individual can get the benefit for the services.
Mm-hmm.
As in New Jersey has a moratorium since 20 years. There is no more Certificate of Need is available to buy or open because the Department of Health is did a moratorium on that one. Only 40 to 50 agency out there in New Jersey versus our population is 1.5 million, 60 above. And in 10 years, this population will going to rise around 2 million. And those
That fall under Medicare.
Medicare,
Okay.
yeah.
Just so we're
The
clear.
falls under the Medicare because you are high taxpayer, I am high taxpayer, I'm not going to receive the Medicaid, right? So we will going to have the
Right.
Medicare. So if I get a sick and I go in a hospital and I need to be taken care as a limited time, 30 days period of the time, I can only go through the Medicare or either private pay because we are not Medicaid, right? We don't get Medicaid. So under that population, you see the 2 million, there is a the more agency needed to be open. For me, I feel this moratorium is not allowing us to grow in a right direction to support more individual because it's care who needed it. In a lot of individuals are in the hospital patient, right? They wanted to discharge with the care, but only 50 agency, 45 to 50 agencies holding the license.
For the whole state.
So whole the state.
To
Yes.
service
The
2
line of
million
the service.
people.
1.5 million people.
Right now.
Right now.
Correct.
Right? So either they're paying from the out of pocket, either they having a shortage of the staff, right? So where the care is lacking because is a readmission, rehospitalization because of the they are not getting the right time the services line for the individual, right? So I think the state has to be rethink about reopening the medication certificate of need for the New Jersey new provider. That is the way we can support the individuals with the hospitals readmission and supporting for the under the Medicare certificate. You can also provide skilled nursing, physical therapists, occupation therapists.
Which I know you provide.
I provide, but under the Medicaid.
Right.
Right. So that is the huge difference, right? So that's what we are.
So you're not allowed to provide it for Medicare patients?
So not Medicare patient because it's mandatory right now in the New Jersey. So Medicare population, if I wanted to provide, I have to own the different physical therapist center to provide the services. Again, that is only Part B, right? It's not Part A.
Okay.
In New Jersey, need to be structured the way it's structuring. If I'm providing the therapist through the Medicaid, is only pay me $65, $35.
Which is the lowest
Very
in
lowest
the whole region,
region,
for
right?
reimbursement
Rate. So I think the state has to be rethink about the structure. I know is that this is a tight budget here, where we are trying to be find and raise our voice for this certificate of need, as well as the workforce. I would like workforce to talk you can.
Well, to elaborate on the certificate of need, New Jersey needs to be poised for the future to be able to provide the care that the senior population is going to be in such dire need of. Maybe 20 years ago, we didn't need additional agencies to help serve this population, but now it's clear that the need is there.
And
Yeah, go
also, we see a huge, challenge regarding the workforce. The workforce is the huge challenge because it's a nursing, right? The nurses is right now, we have to produce more nurses to be serve the population, right, in the right way. So New Jersey we have to develop the right technique to train our own staff. We do provide the training for our caregivers, right, who
Right.
wanted to be certified under the Board of Nursing. We do provide. But there is a still shortage. We need to work with the workforce system.
In terms of the shortage, my understanding, the latest figure is nationally, we have a shortage of 200,000
Correct.
nurses
Correct.
and 90,000 doctors.
Correct.
So we're in real serious trouble. But Christine, you wanted to...
We're in serious trouble when it comes to workforce, especially for home care. Well, actually all across the sectors of healthcare here in New Jersey. So I can share with you that currently there's a 17% shortage of nurses in New Jersey alone. And there's a 21% vacancy rate of open positions. Those open positions are extremely difficult to fill. Hospital settings are paying about 15% higher wages than we can in home care due to our low reimbursement rates. Low reimbursement rates equals low wages. So they're going to go where the money is, obviously. And what that in 10 years, if the predictions are accurate, we stand to face a 25% workforce gap. That equals 24,000 nurses here in New Jersey alone, not able to serve our 2 million population of just seniors that we're talking about. Another interesting fact here in New Jersey is 50% of the workforce, the nursing workforce, is of the age 50 and over. The median age is 54. So what does that mean? In the next 10 to 15 years, 50% of our nursing workforce will be retiring. We don't have the capacity in nursing schools to replace all of those nurses that we so desperately need. There's qualified candidates out there, but about 1,000 qualified students a year are rejected from nursing programs because the nursing programs don't have the faculty, the clinical settings aren't there for them to do their clinical rotation that's necessary for graduation to become a nurse. That's just on the nursing side. On the home health aide side, again, low reimbursement rates. We're losing home health aides to retailers such as Walmart, Target. Their starting salaries, $18 an hour, up to $20 or more an hour. Costco, starting salary, $20 an hour. We can't compete with those types of wages in home care due to the low reimbursement rates that we have currently.
Now, the dichotomy here is that home care versus going into hospitals and clinics and so forth, that it saves money, if I'm correct. Significant dollars are saved to the healthcare system going through your type of agencies versus someone going into the hospital. Am I correct?
Absolutely. I can
Yep.
give you some
Please.
statistics,
Go ahead,
some
yeah.
information on that as well. One hospital stay, a 1-week hospital stay for any patient runs about anywhere from $3,100 to $3,500 a day. So let's estimate $25,000 for 1 week. That's a regular hospital stay. An ICU stay, $42,000 for one stay. We're going to be, the home care industry is going to be asking for our legislators to consider adjusting the Medicare reimbursement rate. We're asking for $4 an hour increase for licensed practical nurses, not registered nurses, just licensed practical. $1
What's the difference between the two type of
registered nurse
Registered
versus a licensed practical
Practical
nurse.
nurse,
yeah.
It's less schooling, and there's a different scope of service. So the registered nurse can provide more nursing services, really based around like assessment skills. A licensed practical nurse doesn't have as higher skill as registered nurses do. But a big part of our workforce is licensed practical nurses, and they are significantly underpaid in home care, being paid higher wages in hospitals and nursing settings. So we're asking for a $4 an hour increase for a licensed practical nurse. What that looks like, one private duty nursing case, maximum number of hours provided through the state, typically 16 hours a day. And that's not always the norm, it's less, but I'm going with 16 hours a day.
Okay.
$4 an hour increase over the course of the year is about $23,500 annually. That one hospital stay, regular hospital stay, $25,000
For the week.
for the week. You invest in home care, you stand to save a lot of money from eliminating rehospitalizations. They get the care that they need in the home. They don't need to go to the hospital. Home health aides, let's look at that. We're asking for $1 an hour. Average home health aide case, 20 hours a week, I'm going to say. What is that? $20 a week. Over the course of a year, $1,000. It's not a lot of money. But meanwhile, hospitalization, $24,000 for 1 week.
Would you believe we ran out of time?
No.
Wow.
So, Geeta, would you tell people how they can get a hold of you and the importance of them speaking to their legislators to support the type of services that you and others are providing to the residents of New Jersey?
Definitely. I especially urge New Jersey to legislate to support our new bill for the increasing our PDN rate, as well as increasing Medicaid rate for the home health aid service
Right.
line of the business. And that was our mission to support each individual. And lest we create the community, the faith, wanted to give one message. Have a faith on us. Lest we create the community where we can serve all individuals with the dignity and the quality of life which they deserve, and make them independent as much as we can. So if you wanted to reach out to us, you can go through our website is faithcareus.com. You can reach out to our headquarters is 973-244-2480, and have a faith and have a wonderful, happy Women's International Day.
I thank you both so very, very much for the passion that you bring to the work that you do for helping the citizens of New Jersey. To my audience, as always, I thank you so very much for allowing me in your homes each and every week. You have the ability to help take care of the residents of New Jersey yourself by going to your legislators and demanding that they help increase the reimbursements for Medicare and Medicaid for the home health care, which saves the state millions and millions of dollars each year. So take care. We will see you next week.
Thank you.